Dr. Karthik Gunasekaran from the Metromale clinic. We have branches at Nagar, Thoraipakkam and Porur. I want to talk to you today about finding sperms in men with Azoospermia. Now you know that Azoospermia is a condition where there are no sperms in the ejaculate, both in the meat and the centrifuge sample. So in these men, how do you go about finding sperms? Now, one of the most common things that these men are being told by the doctors is either you go for a donor semen sample or you go and adopt. But I have found out by certain techniques that you can locate the presence of sperm in the testis. Now what most people do is subject patients to a procedure known as microtessay. Now microtessay is a procedure where you cut the testis into half and then under the microscope you go and search for sperm for almost about 3 hours and then put it together, and so you can look at the kind of morbidity that is there in doing this procedure. Now I want to talk to you about a very simple procedure known as sperm mapping or bilateral extended FNA mapping. Now the bilateral extended FNA mapping serves as a GPS to find out the location of sperms. Now what we do is basically use needles, fine needles, to actually go into the testis in multiple locations and retrieve cells. Now mind it, we are not cutting tissue, we are just taking cells. We take these cells, put on a slide, stain them and send it for cytology. Now wait for the cytology reports. The cytology reports take about 3 weeks to 4 weeks to come. Once the reports come back, we examine them and then concur with the cytopathologist, and once we know that where the sperms are found, we put it on a map. Now the map clearly tells us, okay, sperms can be found at this and location. So it basically serves as a GPS. If I know that sperms are found in the right testis in location 1, 4 and 9, then during the sperm retrieval procedure, I know exactly I need to go to 1, 4 and 9 to get these sperms and then do the ICSI procedure. So it's a very simple procedure. There is no need to create testicular trauma. You know that the testis is already compromised because in an azoospermic patient, the testosterone levels will be less, the size of the testis will be small. So there's no need to do any great dissection or do multiple testicular biopsies. We do the FNA mapping, we find out where the sperms are, and by this we can exactly go and do the ICSI procedure with minimal tissue trauma. Thank you for watching and please subscribe to us. This is the sperm mapping procedure.